Where are we globally with microbicides? Well, most of the microbicides being developed are anti-retroviral microbicides, so we cannot ignore the context within which we're trying to study those, and that is that there is a licensed oral antiretroviral tablet to reduce the risk of HIV. The US Food and Drug Administration has licensed a drug. So we have to think of the microbicides being developed in that context. Now we have two products that are being looked at in phase 3 studies at the moment, which may go on to be licensed. One is a vaginal gel that's being used before and after sex, and we hope the FAX-01 study will confirm the Caprisa result, which showed a 39% reduction in HIV. That will be very exciting. I will be particularly interested in that because I've taken part in microbicide research with vaginal gels for many years, and I know how much women and their partners enjoy using these gels. I really feel they'll be very desirable as products once they're licensed. So fingers crossed for FAX-01. There are then 2 intravaginal ring studies that are going on with dapivirine continuously released. If they show benefit and we have a licensed ring, that opens a whole doorway to multi-prevention technology, because you could combine in the ring the release of the antiretroviral with hormonal contraception. And whilst women may not perceive themselves to be much at risk of catching HIV in the next year, if they're sexually active, they're definitely at risk of getting pregnant. So I think these studies we're watching very closely. We should know by 2016. They're very exciting. There's masses of work going on in the early pipeline. Chalmers made a major contribution to that, and we have a range of large products that are being investigated, but it is challenging to see how we will take them through to licensure. And I think it does behove the clinical trialists and the biologists to try and find a more efficient way to put the package together to make sure we can give people a choice of products. Because one thing is for sure, there are lots of people not using condoms for a number of complex reasons, and that is a gap that we have to fill.